And welcome to the Dr. Bob Show. We're going to be spending most of this show talking about snoring. Why do people snore? Do women snore? Do men snore more than women? Do children snore? Is it dangerous to their health? Is it dangerous to the other people that are in the same house as somebody that's snoring too loudly? How loud can people really snore? And also, not only snoring, we'll be talking about sleep deprivation. What happens to the body when we don't get 7.5 hours of sleep? What are the dangers to our health when that happens? My guest is Dr. Chris Nolte. Dr. Nolte is a board certified and fellowship trained sleep specialist. So he has had extra training in sleep. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about the connection with obesity and type 2 diabetes. How do we really know if we've got it, and what can we do about it? And also, how does an elevated cholesterol damage blood vessels that can cause heart problems, kidney problems, and problems to our extremities? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Chris Nolte, board certified and fellowship trained in sleep medicine. Extra training to help you and I learn what we can do about sleep problems. Chris, welcome to the Dr. Bob Show.
Thank you for having me.
The more I'm in private practice, the more I recognize that a bad night's sleep or problems at bed that don't let us sleep well affects people's health. Is that a true statement?
Yeah, it's really becoming more and more prominent over the last, I'd say, 5 years or so. You know, from the sleep standpoint, we were trained in this. We're trying to get the word out, and you know, people are busy, doctors are busy, they got their own specialties to worry about. And over the last 5 years or so, I think the research has caught up with a lot of different specialties to know how sleep interfaces with your heart health, with your brain health, lots of different things.
Yeah, it really does. Why do people snore?
Well, it usually is a combination of different factors. So it could be a bad nose, which is a very common thing in this part of the world. So that could be allergy.
So a bad nose, is that the noise from the nose? Is that the snoring part?
Yeah, so snoring can originate from the nose, either because it's congested and blocked, allergy, crooked nose. That's where the structural blockage comes from. What I deal with mostly is snoring that comes from the back of the throat. And that's the kind of snoring that can link to more serious conditions like sleep apnea. And then weight. Weight is an issue that we deal with in this country. It's a big problem. And generally, as weight increases, snoring can worsen.
So basically, I think as I'm thinking of the nose and the throat and the tummy, it's anything that makes us pull to breathe. A bad nose, we breathe through the mouth. A bad throat, we got to snore through the throat. And if the diaphragm doesn't move down because of obesity, we pull and we snore again.
Yeah, there's just more and more resistance to moving that air in and out freely. Yeah.
Does the snoring itself cause health problems?
Can. They've looked at this long and hard, and people who snore loudly, we think can get a little bit more blockage in these large arteries that supply the majority of the blood to the brain, the carotid arteries in the front of the neck there. So when I see someone who snores, I'm always listening carefully to make sure they don't hear any abnormal sounds there. Snoring can also fragment sleep. So it's sort of a spectrum. Just because you snore doesn't mean you have sleep apnea. But just because you don't have sleep apnea does not mean that your sleep isn't affected by the snoring.
So you can snore loudly enough where it wakes you up.
Yeah, untreated allergy by itself can fragment your sleep and is a big cause of daytime sleepiness.
How does a person know if they snore? I've never heard myself snore.
Usually an external partner, somebody. So our biggest referrals are family. Someone goes into a medical facility for a procedure, and the medical team, sometimes the patient's the last to know. I mean, they may or may not have complaints about the way they sleep, the way they feel, but usually when you ask them why they're in front of me, they're pointing to somebody else.
Do men snore more than women, or is it about the same? What's the deal
Yeah,
there?
men a little bit more. Probably about 4 out of every 10 men will snore, maybe 2, 3 out of every woman. Kids can snore too, a little bit less frequency there too. And snoring and sleep apnea often is a little bit more male predominant until menopause, and then women start to catch up. There's a bit of a hormone influence here, and sort of towards the latter part of your life, the women and the men are kind of equal.
What do we do about it? Well, how can we teach people how to cure their snoring? How do we get rid of snoring?
Well, so you have to sort of take that history and see, do they deal with allergies? Have they had a problem with their nose in the past? So sometimes you're sending them to the allergist, to the ear, nose, and throat surgeon. What we're doing oftentimes, obviously in the sleep clinic, is to do a sleep study on that person to see what the influence is on their sleep quality. So do they have apnea or do they just snore? If they have apnea, how bad is it?
What is apnea?
So if the snoring is coming from the back of the throat, behind the tongue, above the Adam's apple, that part of our airway relaxes when we sleep, like all of our muscles do when we sleep. And so for people with apnea, that relaxation brings that tongue closer and closer and closer to the back of the throat until it rests on there, and that blocks off the airflow. That is the apnea event.
So you don't have any breathing during that period
Correct,
of time?
yes.
How long can that last?
So outwardly, if you're watching someone do this, they snore, 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 then they kind of get quiet, then they snort and choke and gas themselves awake, and they can repeat that over and over and over again. And this can go on, I mean, to even consider it significant, it has to last at least 10 seconds, but we're seeing people who can do it for much, much longer than that.
So they can have sleep apnea for 20 or 30 seconds?
Until everyone in the room gets a little bit nervous about it. Absolutely, yeah.
When somebody actually stops breathing for a period of time, like 30 seconds, well, what happens when the body doesn't get oxygen because we're not breathing?
Well, you may have heard of that fight or flight response. When you turn the corner and see that mugger, you get this adrenaline surge. You're either going to knock the guy out or run away.
Yeah.
It's that same system that kicks in when the body is trying to breathe, no air is flowing, no air arrives to the lungs, so the oxygen level in the body starts to drop. The body senses something is wrong there, and so it starts to put into the system more and more and more adrenaline to try to get you breathing again. So the brain gets jarred awake. Not that you're aware of it, it's not that you fully wake up. But as soon as the brain wakes up a bit, these muscles get their strength back, the tongue comes away from the back of the throat, and the snoring stops. The snort happens and the breathing begins again, trying to bring the oxygen levels up.
So that period of time where you don't have enough oxygen, it could bother the heart, have irregular rhythms, could bother the blood pressure, the adrenal gland hormones come out to wake us back up. It can really interfere with health. And actually, what does it do as far as patients' weight? Does sleep apnea make people gain weight, or heavy people makes them have sleep apnea?
Well, it does two different things. So the link between sleep and weight is sleep deprivation, all cause. So whether that be you're in bed 8 hours, but it's a lousy quality 8 hours because you've got an untreated problem like sleep apnea, or you're just busy and you get 6 hours and you need 8 hours. They've looked at people who are sleep deprived versus well rested, and how do they intake calories? How does the body manage those calories? Yeah. And those two groups and studies are about the same until about 7 p.m. And then that sleep deprived group starts to veer off course a little bit. What they eat, how much they eat, when they eat, starts to vary from people who are well rested, and that leads to big weight gain.
Are there devices, I hear the word CPAP, are there dental devices, are there CPAP machines, are there things that stimulate the tongue, are there things that we can do to open up that airway where we don't have sleep apnea with snoring?
Yeah, there are many options now, more than there ever used to be. And again, if this is the problem where that tongue rests against the back of the throat, the name of the game for treatment is to get that tongue off of there. So those CPAP machines, little breathing machines for sleep, use air pressure to do that, just blow the tongue forward. It's like the air compressor at the gas station. You just put air in your car tires, but nicer looking and smaller and quieter. But you don't necessarily have to use that. You can mechanically pull the tongue away, and those the dentist gets into the picture here by making a little mouth guard. These have been around for a long time, but the biggest hurdle for them was always a cost issue. Medical insurance didn't cover them until about 5 or so years. And now that medical insurance has covered them, you hear a lot of advertising about mouthpieces for snoring and apnea. But the process is the same. move the tongue forward, in that case by moving the entire jaw out, because your tongue attaches to your chin. So as your chin goes out, your tongue gets pulled away from the back of the throat. And there are some more either invasive or high-tech kind of approaches that aren't for everyone. And these are neurostimulators that try to get that tongue muscle activated while you're asleep to move the tongue out of the way.
As I'm listening to those answers of opening up the airway, it seemed like somebody who is a specialist would be able to guide which seems to be best for that person. So is it a good thing for people to have a sleep study?
I think so, because you've got to figure out where you stand on that spectrum. You don't necessarily want to get some invasive surgery for a very mild case that can be cured by a little bit of weight loss, per se. If you're on the other end of that spectrum, very severe, which carries with it a lot of risk to your heart, to your brain, everything else, it's a different ball game. You're looking at different treatment options there. So that's what I do on a daily basis when I review people's study results. I'm trying to figure out a game plan.
If people are not snoring, and there's no problem with obstructive sleep apnea, can you teach people how to get a good night's sleep if they're not sleeping well?
Yeah, boy, this is not something that we emphasize much, but yes, this is something we deal with all the time.
And that's what we're going to be talking about when we come back. Do you know you could get a better night's sleep if you really know what ball game you're in? We'll be learning about why you don't get a good night's sleep and what we can do to get a good night's sleep so we can be fresh and ready to watch the Dr. Bob Show. We're talking with Dr. Chris Nolte, board certified sleep specialist, fellowship trained. We've been talking about snoring, what causes snoring, bad nose, bad throat, bad belly, what we can do to stop snoring, fix those things that are causing the problem, the hazards of snoring. Men and women both snore. Women begin to lead the league as they go after menopause. And so it's something that everybody is aware of, and most likely getting good information from a sleep specialist will guide you toward snoring not causing health issues. Now we're going to be talking about sleep deprivation. What happens if people don't get 7.5 hours sleep, or how much sleep do they need, and why don't people get a good night's sleep? So let's start off. Why don't people get a good night's sleep?
Busy lives, I think. That's the most common thing that you see. There's a whole school of research about getting just a little bit less sleep than you need every single day. And what does that do to your objective performance? Things like problem solving, reaction time. And that little bit, say you need 7.5 hours and you get 7 or 6.5. That little bit every day of sleep deprivation starts to build into pretty substantial performance problems. They did this in medical trainees where, it's a very rigorous thing when you're going through your training where you're up at 30 hours at a time, that kind of thing. The scary part about that is the longer you're up, the worse your performance gets objectively. But your own subjective experience is that at a certain point you get your second wind. So you feel like, I'm doing great.
I can handle 4 hours.
Exactly right.
Sleep.
I'm doing great. And still you're continuing to make bad decisions, bad errors. The front part of the brain, the frontal lobes, where your personality is. I think all of us have had that experience where if you are not rested well, you're grouchy, you're not yourself.
That's really me. I have to really be careful. If I haven't had a good night's sleep, I'm more irritable, and it makes it more difficult for the people around me.
Yeah, and there's a little bit of research in the military. If you are an introvert versus an extrovert, your susceptibility to that sleep deprivation changes a little bit. The introverts are a little bit more hardy when it comes to sleep deprivation than the extrovert. So, someone with a TV show might be a little extroverted, and there you go.
So how do we teach people to get 7.5 hours sleep?
So you have to prioritize sleep first.
What does that mean, prioritize sleep?
Well, boy, just look at your own life. Look at all the things that you do after the workday ends. You've got family obligations, you've got dinner, you've got chores, you've got all those different things that fill up your evening. And so what we're trying to really teach people is there's a time for that. There's also a time to calm that down. And for those hour and a half before bedtime, you really need to focus on relaxing things, quiet things, sort of spa-like, I'll tell my patients.
My wife is so good at that. She prepares to go to sleep and enjoys a warm bath and just relaxing before she goes to bed. So preparing, you're slowing down. What, going to bed same time?
Yeah, so sleep schedule is a big one. Most people focus on the bedtime, and really what I try to teach them, if they're having trouble, is to focus on the wake-up time and to go to bed just whenever they're sleepy. So what you'll see often for a lot of people is they'll try to go to bed at a certain time just because they feel like that should be a good bedtime for them, whether they're sleepy or not. And those nights that they're not sleepy, they'll lie in bed for a long time, and they get frustrated by that. But their wake-up time is also highly variable. They'll get out of bed early some days and sleep in, crash, sleep in real late. So we try to keep that wake time consistent 7 days a week until things start to regulate and get a little bit more consistent. The other big factor for a lot of people is we don't get as much sunlight as we used to. We're inside, or you hurt, or there's some reason why you're sort of sun sensitive, you're on medicines that make you that way. So you withdraw in, and you start to get a real problem with your body rhythm as a result.
So the body learns to be awake and be asleep by the amount of light that it's exposed to, and what kind of light?
The most powerful influence is the sun. It's the blue part of the rainbow that does that. So I always tell people, go Little House on the Prairie. Remember that old So if you can be up and be out and be active, regular meal times, and then at nighttime make a clear distinction where things are calm and dark and dim lights. That's your best bet.
My wife says, when you wake up, get up. When you get up, do something. And so you want to make that a light time of day, and then go to bed at a time where you know you're going to have 7.5 hours sleep. Now, what are some of the impediments? What can keep me from falling asleep?
Well, you've got some lifestyle ones. The biggest one these days is technology. We're in front of our phones, we're in front of our tablets right up till bedtime.
Is that bad?
That's quite bad. I mean, those technology screens emit a lot of blue wavelength light, so it fools the brain into thinking it's sunlight. So they've done studies on this to show the influence of that, and it delays how long it takes to fall asleep, how long it takes to feel rested the next day. So technology, we always pick what's called an electronic bedtime to make sure that you turn all of that stuff off about an hour or so before bedtime and focus on more relaxing things. You also have to look at medical things. You've got people who are on medicines that keep them awake. They have aches and pains that keep them awake. There are certain habits. Nicotine is a big one. This week I saw several patients.
Whoa.
As part of their relaxation, they smoke, not knowing that nicotine is a stimulant, just like caffeine. So they fall asleep because of that ritual, but sleep on stimulants is highly choppy and fragmented, and they're waking up for no good reasons. It's frustrating to them because their sleep quality is poor.
What does alcohol do to sleep?
It's a little bit more complicated. So a lot of people will know, if they have a little bit of alcohol, it calms them and it makes them sleepy. That's true. The first half of the night actually doesn't look much different on alcohol. But as the liver breaks down that alcohol and it starts to leave your body, the second half of the night is quite poor, highly choppy and fragmented.
So you don't get a good, restful 7.5 hour sleep. You mentioned pain. If I got a bad shoulder, or if I got a bad knee, or a bad foot, or bad anything, how does that keep me awake?
Well, a lot of people have this problem. We're always coaching people to try to stay off their back when they snore, have breathing problems. And boy, they try, but they just can't because their shoulders hurt, their arms go numb, their hips hurt. The medicine that they take to control their pain, from just simple over-the-counter products, which can make you have insomnia, to heavy-duty narcotic medicines, which really cut down the deep sleep that you get, the dreaming that you get, all influence your sleep quality too. So we're really emphasizing the bedroom environment, making sure you got the right mattress, it's cool, it's dark, that kind of thing.
When does a patient need to see a doctor?
I think a lot of that is commonly available, and people will get online and try to research a little bit, and then they don't have much success. Maybe because they only do this partially or partially correct and need a little bit of coaching. It's just like, kind of know when you go to the gym, you need to lift some weights, but you need that trainer to kind of put you on track there. Sometimes the assumption is, well, it's just my mental state. I can't shut my mind down, and that is super common. But we'll oftentimes find through our sleep testing that there's another cause that they're not aware of. and that can be restless leg syndrome is a common one, or trouble staying asleep because they're not breathing well. That's another super common one.
Is it gratifying being a sleep specialist?
Every day, every week, you hear someone say, boy, since I fixed my problem, I'm a new person. Didn't really know how bad I was till I got fixed. And you hear that commonly.
That must be a great thing to hear. And I hear patients say, when I went to the sleep doctor, I woke up the next morning and didn't realize where I was because I'd gotten my first good night's sleep in a long, long time.
There's a lot of apprehension around sleep and sleep testing, and people are very sort of possessive and territorial. Don't mess with my sleep, I'm fine. But when they really kind of get encouraged by their family and things like that to come in for evaluation, and they sort of see what their problem is and get that fixed, it's a game changer for a lot of people.
Can't wait to go to bed tonight to get a good 7.5 hours sleep. Chris Nolte, you're a great teacher, and it's so important for us to understand the importance of a good night's sleep, and when we don't have it, to get it corrected. Thank you for coming to the Dr. Bob Show.
Thank you for having me.
A lot of great information for you. You're going to want to stay tuned. We're going to be talking about obesity and diabetes. There is a connection. Why? What is it? What can we do about it? And how does cholesterol really cause blood vessel damage? A lot of information for you. I want to thank Dr. Chris Nolte. Wonderful discussion on snoring and the importance of a good night's sleep. Now, questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob. I'm overweight and everybody tells me I better be careful, I'm going to have diabetes. Is there a connection? Yes, there is a connection between obesity, being overweight, and type 2 diabetes. Now, type 2 diabetes is where your insulin is not working well, and the glucose, everything that we eat turns to sugar, has to be metabolized for energy in the cell. When people are obese, they have insulin resistance. That means the insulin doesn't work as well. When it doesn't work well, then the blood sugar becomes elevated and the hazards of diabetes occurs. Now, what are those hazards? Well, for reasons that we don't know, the small blood vessels are involved and become damaged. So we get damage to the blood vessels in the kidney and we start getting kidney failure. Most common cause of kidney failure is diabetes. We get eye problems. The most common cause of blindness is diabetes. We get heart problems. One of the most common causes of heart problems is diabetes and cholesterol. So what can we do? Well, we need to know how to make the diagnosis. There's a test called A1C, or hemoglobin A1C. It's the best test for you to decide whether or not you have type 2 diabetes. The one blood test will tell you what your blood sugar has averaged over a 3-month period of time. So it's not like getting a fasting blood sugar where you can say, well, I'm going to watch what I eat for 2 days before I go see the doctor and he won't know what my blood sugar is really like. Hemoglobin A1C will tell the doctor if your blood sugar has been elevated for a long period of time and if you need to start getting to work on obesity and type 2 diabetes. It can be a life changer. Next question, Dr. Bob. How does an elevated cholesterol damage blood vessels? It is a good question. We've known for a long time that having an elevated cholesterol related to having hardening of the arteries. Then we found out that it wasn't the elevated cholesterol, it was the different types of cholesterol. So there's an LDL, I call it the lousy cholesterol, and the HDL, the happy cholesterol. The HDL, we want more of it and more of it. Not many ways to elevate your HDL. Exercise will, and keeping your weight good will. So the HDL comes in and cleans out the bad cholesterol. It's the LDL where the problem is. If the LDL, the lousy cholesterol, is elevated, then it can be oxidized into the lining of a blood vessel where it's deposited into that blood vessel. And we begin to get cholesterol plaques in blood vessels. in the blood vessels that line the heart and feed the heart, the coronary arteries, in the arteries that supply the kidneys, in the arteries that are going to our extremities. So people, when they start getting elevated cholesterol and cholesterol plaques from oxidized LDL, then they can start getting claudication pain when they walk. They can start getting protein in the kidneys. Their vision becomes weaker and weaker. They begin getting chest pain with exercise, angina. And so with angina or angina, both words are correct. And so with that in mind, very, very important that we know what our cholesterol is, that we begin to lower our cholesterol, that we eat well, that we don't smoke. Cigarette smoking helps damage the blood vessels that allow the cholesterol to be deposited. So know how important it is to have good health and to keep your cholesterol low. All the time that we have for this show, remember those 4 things. Exercise. What does exercise do? Well, it lowers your cholesterol, lowers your blood pressure, lowers stress, makes you sleep better. I mean, what more could you want than regular exercise? Don't exercise right before you go to bed. Eat properly, eat better foods. Saturated fats, fried, greasy foods, not what you want to eat. More fruits, more vegetable, more fiber. 7.5 hours of good, restful sleep, like we talked on the Dr. Bob Show earlier, will make you feel better, will make people around you feel better. And most of all, what do we like it in the Dr. Bob Show? It's that laughter in your life. Be sure you find people that you love, you tell funny stories, that you laugh a lot, you giggle. It'll make your immune system work better. You'll have less infections. You'll stay healthy and you'll stay happy.